Acid reflux, besides it being very uncomfortable and actually painful for the ones that had it, it has devastating dental side effects. So the reflux and the acidity in the mouth can cause some of the worst cavities you'll ever imagine over time as the teeth bathe in acid. And that simply ruins teeth. And then you just need a lot of dental work, and sometimes teeth are not even salvageable. So, we are not in a position to offer remedies for acid reflux, but we all know the basics, okay? The fried food, the quantity of the food, the timing of our nutrition before bedtime. And we need to see a medical professional, specifically a GI doctor, to manage that. But from a dental perspective, very often we would be the first ones to diagnose it, because many patients have subclinical acid reflux. So they don't have the symptoms, but they have that low pH, that acidic pH in the mouth. And we start to see erosions. So remember that word, the word erosion means that some structure has been taken off from something that is very hard, like a tooth structure. And it doesn't happen over one day or a week, but within a few weeks or a few months, you would start seeing those erosions close to the gum, and also in areas where we typically don't develop cavities. So if your dentist is telling you, this cavity, there was nothing there, but 3 months later, it's a huge cavity, or that's a very unusual cavity. So I want you to have like a little red alert that you might be having acid reflux. And a lot of our patients that we actually refer to a GI doctor are proven to have reflux, and there's treatment for that. We don't have to get into, the essence of it, but a lot of it has to do with lifestyle, nutrition, and sometimes it needs to be treated pharmacologically. Dr. Herman, do you have any comments about reflux? Because it's a very common issue amongst our patients and people in general.
I guess one of the comments is probably trying to have the head a little bit above the stomach, so that you're not having as likelihood of that the acid coming up from the stomach up to the teeth. So that's one possible thing.
Excellent. Ari, any comments about acid reflux? I think every human being at some point in their life, felt heartburn, felt like they shouldn't have eaten that food at a certain point in time. And we know how uncomfortable it is. Imagine you're having this on daily basis, and then your teeth go kaput. And what is your advice to patients that have this type of problem?
As both of you said, it's a medical problem, but it affects, unfortunately, us diagnosing it. And the only advice that we can give patients is get medical advice, get medical treatment. But if you're aware about having dental acid, it's very important, as Jeanette mentioned it, hydrate and rinse as many times as you can. And it's very, very important for those patients who have acid reflux is to make sure that they have very good hygiene habits, and flossing and brushing and using all protective measurements like applying fluoride on the teeth in order to try to have some remineralization happening. So have your water bottle next to you, and don't forget your toothbrush. And that's, I think, the only thing that we can help reduce the effect of it.